Welcome to Faith Over Fear, the Christian Pregnancy and Birth podcast. I'm Natalie Portman, a wife, mama, birth doula, and childbirth educator. And I believe God has a better way for us to experience birth, one without fear, striving, or self-glorification. If you're ready to stop feeling overwhelmed and instead trust the Lord more deeply in pregnancy, birth, and motherhood, you're in the right place. Here you'll find inspiring birth stories, biblical encouragement, and practical wisdom to help you walk in faith over fear during this beautiful and challenging season. Now let's get started.
Hey there, Mama. Welcome back to the podcast. I'm so excited to have Dr. Kate Smith with me today. Dr. Kate is the owner and founder of Nurture You Pelvic Health, and she has over 7 years of experience as a pelvic floor physical therapist specializing in prenatal and postpartum care. What I love about Dr. Kate's approach is that she takes a holistic, full body perspective to really get to the root cause of pelvic floor concerns, not just treating symptoms, but really helping women truly understand what's happening in their bodies. And today we're diving deep into a topic that I know affects so many during pregnancy: hypermobility and pelvic pain. If you've ever had that sharp stabbing pain in your pelvis during pregnancy, or if you've wondered whether what you're feeling is normal or something that you can actually get help for, this conversation is going to be so valuable for you. Kate, I'm so thankful that you're here with us today.
Yes, thank you for having me, Natalie. I'm super excited.
Me too. And this is so near and dear to my heart because I shared during my birth stories that I had really bad pelvic pain during both of my pregnancies. And so for the mom that's experienced or is currently experiencing sharp stabbing pelvic pain, can you help her understand what's actually happening in her body and, maybe why some women might be more prone to that pelvic pain than others?
Yeah, absolutely. So I think one of the biggest things, or I guess like educationally to take away here, would be when we're talking about SPD pain or symphysis pubis dysfunction, or honestly, I usually call it just like pubic symphysis pain. For me, it's easier to say it that way versus SPD, I guess, in the medical terminology. Or there's also pelvic girdle pain, which is obviously pain within the whole pelvis, or SI joint pain. And so I'll find a lot of times when people reach out, even to talk with me for pelvic floor physical therapy, they'll say they have SPD pain, pelvic girdle pain, SI joint pain, but it's really up to me to determine, okay, what exactly is going on and what does that look like? But just for, any mamas at home, if we have, say, a sharp pain in the front of the pelvis or directly in the center of your pelvis, and that could be more likely, of course, SPD pain or pubic symphysis pain or some form of dysfunction there. I usually find it's most often, obviously, towards the second and third trimester. However, it can occur, of course, in that first trimester, but also people can have this even without ever having children or even prior to pregnancy. And we usually see symptoms that are more asymmetrical, I guess you could say, in the sense of more pain with maybe walking or stair climbing, or you might notice that sharp pain when getting in and out of the car, rolling over in bed, trying to stand on one leg to put on your pants. Anything that's going to create more of a single leg stance or an asymmetry within the pelvis is going to create more dysfunction or more pain in the center of that pubic bone or pelvis. One thing I always like to note, though, too, with pubic symphysis pain and SPD is that if it is off to one side, because that's what people will say, oh, I have SPD, but it's more right-sided. I always, for me as a pelvic floor physical therapist, I want to look at the round ligament too, because the round ligament also attaches into that labia. So you might think that you have SPD dysfunction, but it could actually be related to that uterine ligament. So that's just one thing to side note if you're hearing this and that's you, because that's something we would look at. But then if we get into SI joint pain or more of that pelvic girdle pain, we usually see that more in the back of the pelvis. So where you have those dimples, I guess you could say, if you were to reach behind you and feel, where your low back is and where your low back meets the buttock area, that's going to be more SI joint pain. I see that more often, of course, with bending or lifting. Sometimes, yes, rolling in and out of bed, sleeping on one side. it can still affect you, obviously, with like single leg standing or a lot of times, with walking and things like that, but it doesn't present exactly the same as SPD or pubic symphysis dysfunction, I guess you could say. So it just depends on what's going on within the pelvis. And then I guess also with that being said, when it comes to SPD pain and the SI joint pain, it's being affected differently as far as different musculature. And that's where, for me, with my practice, getting to the root cause of what exactly is causing that pain. Of course, we know that we're already at an increased, I don't want to say risk, but we have increased chances of SPD pain and pelvic girdle pain and SI joint pain during our pregnancy just because of ligamentous laxity, right? Because all of those changes within the hormones are doing what they need to do to obviously make changes for baby, for labor and delivery. However, that can create, again, more mobility within the pelvis that can lead to more pain. I'm a big advocate too for pelvic floor physical therapy prior to conception. And I think part of that is because I hate to say it, but pregnancy and postpartum really highlights your imbalances and your weaknesses. And so if we already have those imbalances and weaknesses, and then you add hormone factors into it, postural changes, more weight from baby, placenta, fluids, and all that thing, those muscles have to work to stabilize. And it's not just the pelvic floor and it's not just the core, but it's all those muscles surrounding the pelvis. It's how we even move within like our feet and our ankles, because that's going to affect how we squat and how we hip hinge to lift up our little ones. And not to mention, if this is also a subsequent pregnancy, we that sometimes are even a little bit more of an increased risk if we haven't worked on those imbalances postpartum. Hopefully that makes sense. And then also leading into, other factors are hypermobility. I know you and I have talked a little bit about this, but if we are considered more hypermobile, or even if we might have something called EDS or Ehlers-Danlos syndrome, that's going to even set you up for more of a chance of instability or increased mobility in the pelvis, which can also further lead to more pain. And so usually that's something that I know we'll dive into a little bit more, but ask clients about, especially during pregnancy and postpartum.
I stumbled across the idea of hypermobility after I had Daniel. So this was my second pregnancy where, again, I was dealing with excruciating pelvic pain. Like it hurt just to exist. And I came across hypermobility and realized, oh my goodness, I think I'm hypermobile, which maybe is the reason why I experienced this really intense pelvic pain during both of my pregnancies and even into some of the postpartum period. So for someone who is unfamiliar with this idea of hypermobility, what are some signs or symptoms that you might be hypermobile or have one of those hypermobility disorders?
Yeah, that's a great question because I feel like obviously there's a lot of variability with that too. There's different levels. Like some people might be slightly hypermobile, where then we also have that extreme of actual like connective tissue dysfunction. So that's like your EDS or Marfan syndrome and stuff like that. And so what I usually will do is, as I'm looking at, my clients and even just standing and looking at their posture, I'm like, are they hypermobile? If you can see that like their knees are hyperextended, or even as they're moving, if you can see that hyperextension within the elbow, or if you remember back when you were younger, if everyone was always like, oh, you're double jointed. Oh, you're so flexible, all of that. Yep, then that is going to be more, likely that we have hypermobility. But then we can also just do some small things like, can you pull your thumb all the way back to your forearm? Like, can you extend your thumb all the way back? Can you take your pinky finger and can you pull it all the way out to 90 degrees? Those are just like a few classical signs of that. But then also we look at, again, the elbow, if we're hyperextending there. If we have really flat feet, flat arches, are you someone that constantly pops and cracks? Or have you ever had your kneecap go out of place? Or even to like, you feel like your elbows get a lock or go out of place, or just things like that we notice. Of course, like those other connective tissue dysfunction, usually they most likely know about that just because it is a more severity of that hypermobility.
Yeah, I did a post where I showed all of the ways to tell. It's like that just basic assessment to know if you were hypermobile. And yeah, I had all of them personally. And so I was like, oh my goodness, I am like self-diagnosing hypermobility. And it's all kind of making sense after the fact, some of the things. Because yeah, I remember as a kid, and I still can, which is crazy. I had the ability to put my leg up around my head. And like I said, I can still do that. And I'm like, that is like not normal for a 30-something-year-old to be able to dislocate your leg and do that. But yeah, it's very strange because for the most part in my life, it has not presented as issues till I became pregnant. And I right now even have some clients that are dealing with really intense pelvic pain. And I posted that thing about hypermobility and they're like, oh, wow, I'm hypermobile. And I'm like, yeah, I also did not know this until after the fact, which whenever we were speaking, when we connected, I remember us talking about this and your recommendation to start physical therapy even prior to conception. And that is so empowering. And I really wish that we had connected sooner, like before I had my second pregnancy, because you're right. After my first pregnancy, with my second pregnancy, things seemed even more intense. And I thought it was bad the first time. And so, yeah, just that period after having Ellie, and I was not working out regularly like I was when I was pregnant with Ellie. And going for a walk became excruciating, like truly excruciating, to the point where if I tried to walk for longer than, I don't know, 10 minutes, I would ache. And then I would, of course, go into this mode of, okay, I don't want to keep moving because I end up feeling way worse for days after the fact. And so to get in that spiral, that, hamster wheel of like pain and then not wanting to get out of it, I'm curious your approach as a therapist. If a mom comes to you in pain and, she's experiencing what I'm describing, where it's like she's just so frustrated, like she cannot just do basic things. Standing up to just cook a meal is excruciating. So what do you recommend to help her shift her mindset, to just give her some hope, during that season, especially if you're listening to this right now and that's where you're at?
Yeah, I think it's, for one, validating what you're feeling, right? Because a lot of times, I hate using the term as far as like women and, pregnant mamas not being necessarily, or yes, being like gaslit. So to believe that, okay, pain during pregnancy is normal. That's just part of pregnancy. That's just what happens. Some people have more pain than others, so, all of that. And I think that, of course, any pain is your body telling you something, right? We have to listen to that. And so for me, when I see my clients and if they came in, again, frustrated, just in pain, for one, you've already made the first step to improving that. I am here for you. I am here to support you. And regardless, yes, we might not be 100% completely pain free, but I'm going to do everything that I can to improve upon that and to help manage that throughout your pregnancy and keep you moving and give you that overall quality of life during your pregnancy and postpartum that you deserve. And just knowing that there is, I guess, for one, help out there if you never even realize that. Because I talk, obviously I do discovery calls with my clients, and I always like to speak with potential clients before I see them, just to get, again, some more information, talk to them just like I'm doing here, getting to more of the root cause of what is causing that and knowing that there is improvements. A lot of clients think that they just want to start pelvic floor physical therapy postpartum. And they don't even realize that during their pregnancy that they can see me. I'll get calls and be like, oh, I'm just calling to maybe talk to you a little bit before I set something up postpartum. I'm like, actually, it would be really great for us to work together now, because the sooner that I can work with you, the better, overall things will feel throughout your pregnancy. And it's really just either managing your pain or allowing you to not have any pain. So like sometimes I'll see clients, again, pre-conception or really early on in their pregnancy. We can still work together, during that first trimester. Of course, it depends on how you're feeling, and I usually don't do any internal work, obviously, in that first, trimester, but there's so many things that we can be doing to help with that. And yeah, it's just knowing that there's hope out there. There's, obviously myself here in the Jacksonville community, but also if you're listening to this like elsewhere, there's so many pelvic floor therapists out there that are at least now specializing in, prenatal care. So there's hope, and it's just finding the right person and reaching out to them to be able to, improve those symptoms, and knowing that you don't have to just live with it, because if we just live with it during your pregnancy, the chances are that you will also still experience that postpartum is pretty high, just because of still those hormonal factors with nursing, producing, pumping, whatever that might look like for you. But then also, if we were to get, like you said, like we were to get pregnant again and we haven't worked on some of those imbalances, then we usually see them worse in that, I guess, second pregnancy or third pregnancy. For example, I had worked with a mama in St. Pete, and I was working with her through pregnancy. And I was so happy that she had found me, because she was like, my first pregnancy was, like you said, really bad. My second pregnancy was even worse. Their third pregnancy, she's like, from the moment I got pregnant, she's at 5 weeks. I already started experiencing symptoms. And it's because of, again, those hormonal factors, but she was absolutely hypermobile. And so for her, yes, we weren't able to completely eliminate the pain, but it allowed her to continue to do CrossFit, continue to take care of her kids at home, work as well. She was a vet in the area. So she had to do surgeries, all of those things. And we were able to like keep her moving throughout her pregnancy, because in her past pregnancy, she had to stop, and she's like, I don't want to do that. And so it's really getting again to like the root cause of all those imbalances to be able to support the body and the pelvis. So yeah. So there's hope out there.
I love that you're validating it, because I did not feel validated whatsoever when I went through this the first time. My provider, every time I brought it to their attention that I was in a lot of pelvic pain, they did exactly that. They just said, that's normal. Being pregnant is painful. Sorry. And then, like I said, I was doing research on my own, because I was like, this cannot be normal. Like, this amount of pain, like, how can this be normal? And that's whenever I started seeking for myself some physical therapy. And I wish I connected with somebody like you that really knew pregnancy and like the perinatal period, postpartum period, because I just was like with a general, physical therapist that just like my insurance covered. And not that there's anything wrong with that. But again, they were not able to support me in getting me to a more comfortable place in my pregnancy. And then eventually I just fell off the bandwagon doing the exercises and the things that they assigned me, because I was in so much pain. It was like, it's not like they were willing to help, but they just didn't have the tools to be able to really carry me through the pain that I was experiencing. And so that's, I think, one of my biggest regrets is not only, choose a provider, obviously, that is listening to you. That's huge.
Okay.
But then secondly, if you're not getting the care that you need, know that you can seek that for yourself. Like, you can go out and find the people that will help you if you're not getting it from the current places that you're looking for help.
Yeah.
And that it really is, it's more than just experiencing pain in the short term. It's the quality of life. It's the quality of how you view that pregnancy. And it really does even affect like mental health. I shared a little bit about this, but how, because I was in so much pain during my pregnancies, almost every day at the end of the day, I would throw myself on the couch and almost be in tears and tell Brian, I cannot be pregnant again. I cannot do this again. I was so mentally and physically worn down by just feeling so awful. And then there was part of me that was just like, at least I'm not like throwing up constantly. Like, I would try to just, I don't know, situate myself to where I wouldn't be completely down on myself about it. But it took a huge mental toll on me. And so if you're listening to this and that's where you're at too, just knowing that there's help. And like I said, I wish we had connected ahead of my pregnancies, because I would have had so much more hope knowing that there was help for me out there. I didn't even know that was available to me, that was possible for me. Another thing that I want you to touch on is, for the mom that is currently experiencing that, is there anything she can be doing at home, even ahead of, starting therapy, which I highly would recommend? I had those Band-Aid approaches, wearing the belts and stuff, but what would you say are some helpful things that she can be doing to just mitigate some of that intense pain?
Yeah. And that's a great question. That's actually one that I get obviously in a lot of my workshops and stuff is like, what can I be doing like from when I leave here? And I will say, depending on SPD pain and SI joint pain, like it does depend. Of course, like you said, it's really getting that root cause of what's causing it because SPD pain in one client is going to be different in the other client and different in the other client as far as imbalances where, when it comes to the front of the pelvis, like we really want to try to strengthen what we call like the anterior oblique sling. So like those frontal patterns to create stability in the front of the pelvis. Whereas in the SI joint or in the posterior aspect, we really want to help to like strengthen and stabilize that SI joint from the posterior aspect. So think of it like your lats and your shoulder to like your opposite glute. However, still with every client, it's going to be a little bit different of how we work that because we might need to actually release the muscles before we strengthen them. Or some are like, no, we need to focus more on strength and stability. So it does change as far as, it is always individualized, like person to person. However, there's definitely tips and tricks that I discuss with my clients, like from day one. And although this might not help 100%, but it's something that you can start with. So the first thing would be, it's crazy to even think this, but posture. Depending, and I do this even with my clients that aren't pregnant, right? So we tend to want to, whether we are more hypermobile or not at all, we tend to want to extend our knees. So we lock out our knees and we push our hips forward a little bit. And, we have a little bit more sway or I guess what we call lordosis or extension into our back. And then, of course, like our shoulders round forward a little bit sometimes. And of course, as we go throughout our pregnancy, that tends to get worse because it's a position that we can just hang on our ligaments, right? We don't have to do much work to rest like that. However, it's not usually comfortable, or that's why our back hurts, to stand for long periods of time. Or even to, I know we're not going to get into this too much, but diastasis recti, right? Or diastasis recti. If we're constantly in that posture and that sway back and core isn't active and we're not technically stacking our ribs over our hips, then that can also set you up for just more pressure into your abdominal wall, right? That can also affect like things like leakage with coughing, laughing, sneezing and stuff like that. But from a pain aspect too, more so I see this more often with the SI joint pain. But say, if you're listening to this and you're standing, you could stand up, right? See where, that posturing is. And then I want you to put a soft bend in your knees. And I want you to just slightly shift your weight. You're not bending forward, but you're shifting your weight forward, thinking tits over toes. Or chest over toes if you want to use that. People usually remember the chest over toes a little bit better, whatever you prefer, whether that be that or chest over toes. But you'll see even just that little bit of shift forward should take pressure off your back, allow you to engage your core a little bit better. And that's something that we should try to do, if we're standing or if we are standing and carrying a little one, then we really want to make sure we want to get that trunk forward a little bit more. I call it like rib and hip stacking, and that's more of the front of your rib cage over the front of your hip bone. So it's like we want to be able to engage the core and bring those points into a neutral position. I know it's hard, being on the voice to explain it versus see it. But that would just be one thing, like trying that, see how you feel, because that's going to prevent pressure from going down. And it's also going to allow you to activate a little bit more to not just hang on those ligaments. Of course, you're going to. There's going to be times where you're tired and you're going to do that. But when we have that pain, that's your cue to, I really got to change my position and I really need to start practicing this because that is going to carry over to postpartum when those babies are out of our belly and now they're on our chest and you're having to control their head. And so you're leaning all the way back and thrusting your hips forward and having more back pain and things like that. So that would just be one thing. And then going into, again, the ribs and hips stacking, right? As we bend and we move and we lift, a lot of times we want to bend so much with our trunk, right? We want to extend the knees out and we just want to bend forward with our trunk, where time we hinge or we go to lift our little ones or we go to get something, out of the dishwasher or picking up a laundry basket, we really need to hinge with our hips. So that would be shooting our hips back, which keeps the ribs and front of the hips stacked. So that way we're not having so much pressure on our back and also the front of the pelvis. So definitely more so on that SI joint pain, but it can also affect, the pubic symphysis or the SPD pain. With that being said, getting into more of those modifications for SPD pain, it would be if we're getting pain, getting in and out of the car, making sure that we swivel ourselves, keeping our legs are closer together when we get out of the car. Sometimes if it's really that severe, you're probably already doing this, but taking shorter strides. But again, we want to get to the root cause because we need those muscles to work. So we don't want to be doing that. But if, you have to, then that's maybe a modification that we make. Sitting, of course, to put on your bottoms, not getting into that single leg stance are just a few things, or even to rolling over in bed, making sure that we have a pillow in between our knees, but not just our knees, from literally, I guess you could say, our vulva all the way to our ankle. So that way, when we go to roll, it doesn't really change the pelvis too much or that positioning, making it more comfortable. And then the last thing I would say, and again, this would help with either SPD or SI joint pain, is when we go to, say, roll over in bed, or if we go to lift, we really want to think of exhale, hug baby, or engage those lower abdominals, because that's what's going to stabilize the pelvis. Or same thing, rolling over in bed, we're on our back, we take a deep breath in, we exhale, we hug baby, and we roll. Because again, that's going to help stabilize the front of that pelvic area, but also the back. As I know we're not going to dive into this too much today, but as you could probably see, I didn't say anything about Kegels, because obviously with pregnancy, those muscles are already being overloaded. And so I usually very rarely ask you to isolate those muscles and shorten them or contract them, because if they're already shortened, then doing that might actually create more pain than helping anything because they're overworked.
Wow, that is so good. And some of those things I had heard of, some of those I had never heard of. And I wish that I had known about them whenever I was pregnant. I don't know if we talked about this, but I am a certified Body Ready Method Pro. And we talk a lot about just the way, because it's obviously a body ready for pregnancy, birth, postpartum. And I do a body assessment with my clients. They can add on that service of having a body assessment where I assess their posture, and I look at how are they doing a hip hinge? How is their mobility? All the things that we go over these principles. But have you ever heard of Body Ready Method?
I remember when we talked, you had told me about it, but I hadn't additionally looked into it.
Yeah. But yeah, so many of the principles that you're sharing are in the Body Ready Method because it was created by a physical therapist. And so she just took her love of birth and her love of physical therapy and, melded them together. But check out her account. And also you need to be following Dr. Kate on social media because her stuff is phenomenal. But yeah, it is helpful to see the principles and things that you're talking about, because obviously in a podcast format, unless you understand the anatomy and the things, I can follow along with what you're saying because I'm seeing you, but I have that kind of knowledge base, but it is really difficult to understand it if you're what areas of the body are you even talking about right now? Yeah. But it is very important to know, again, that having just not being in pain or avoiding pain or lessening pain in pregnancy is not just this isolated one-off just for this season. This is the longevity of your entire life. I used to walk with my feet out, we call it the duck foot, just slightly. And when I was going through the Body Ready Method training, which was a 5-month, in-depth training, college level training, we were learning about how, keeping your feet straight ahead. And so even me just slowly working on having my feet turning slightly out as just my normal posture, to over time turning them more inward so they're straight ahead. And now I walk with my feet more straight ahead, but that was something that slowly over time I worked on. So, from the time that Ellie was little and I was pushing her in the stroller, my feet would kick the wheels because my feet were out. And now they go straight into that area where the wheels are, in between where the wheels are, because my feet are straight ahead. And so just to give a little bit of an example of, The goal isn't to be like, and today you need to always be sitting properly and make sure to never jut your hips forward. And when you're bending over, always make sure it's a perfect hip hinge. Like the point is not to be perfectionistic about all these things, but to just have an awareness is what I like to say. Have an awareness of what your body is doing so that you can give it a different experience, so that it can experience a better posture compared to what it has been. And over time, your body does get more used to moving in a different way. I started doing, or not started, for the last year, ever since I had Daniel, I started doing body pump. And we do a lot of deadlifts and things with the bar. And even that movement where it's a really good hip hinge and like loading the glutes and the hamstrings, that motion, just constantly doing that motion has made it so much more intuitive to me to whenever I'm bending down to pick something off, off the ground or picking up one of my babies or something, where my body naturally goes into a good hip hinge because that's a movement that my body is used to working through, instead of it just being like this totally foreign thing that I'm asking it to do. And that's really encouraging that our bodies can be so malleable, even though we feel like, oh, this is just my pattern. This is just the way I sit. This is just the way I walk. No, our bodies are so capable of change, and our pregnant bodies are evidence of that for sure, that there is so much change that can be made good, and bad, but really good changes.
Yeah, absolutely. I mean, you hit on a lot of great points there that it doesn't have to be perfect, right? Because it's just the more that we practice it, it's not practice makes perfection, but practice helps a lot. And so I find, going back to that hip hinge where a lot of people, so many people don't know how to. And, that stems from obviously like pre-pregnancy and stuff like that. If you've never looked at it or worked with it, because that I would say like 90, maybe 95% of the clients that I see with low back pain, they usually don't know how to hinge. And it's because that's what they're doing all day, but they're doing it not quite properly or just not aware. But then if you start to change those habits, then it really starts to become second nature. And then obviously too, doing like the workouts and just knowing how to move that way in your body, is really helpful. But also with that being said, if we have restrictions within the pelvis or within the rib cage and the diaphragm, or, weakness in the core, or even to limitations in the ankles, then that's going to affect how you're able to do those things. And so that's where it's trying to, again, okay, see, why can't we hinge? Is it just motor aspect, like motor control, motor memory, or is it because you're physically not able to because of other restrictions?
I remember whenever I would do body assessments much more regularly than I've been doing in the recent past, but I would have a client do a squat, and it would astound me when someone would do a squat and I would say, now I want you to bring your bottom back to where your knees are stacked over the ankles as much as possible so that your knees aren't coming, far forward. And some people got it immediately. Others, they had no idea what I was even talking about. And every time I would try to say, okay, you're trying to bring the butt back, unless I showed them like a modified where they were holding on to something, they could not physically get into that. And I always wondered that. I'm like, I wonder if that's like just, they're not just understanding what I'm saying, or is it truly like their body cannot get into that position effectively without assistance unless, because there are other issues. That's obviously not my expertise, but it's fascinating to go back to think about, those women that just have a hard time connecting with their body in that way, and that it can be learned. But for some, it comes very naturally. And for others, you really have to work on that because of the way your body has compensated, just the patterns we feed it, and then the compensation patterns as a result of that, how we've been using our body.
Oh, yeah. No, absolutely. And I think too, because like you said, it could be a variety of different things. It could be hip mobility. It could be ankle mobility. It could be, honestly, something going on within like the knees or the feet or not being able to stabilize well. But then, obviously for us too, with the pregnancy aspect of things, we also have to look at all of those movement patterns for labor and delivery too, right? So if we have all of these like restrictions, or if we have limited hip mobility and or ankle mobility, like getting into a deep squat during, labor might be a little bit more challenging for you. Getting those hips into a different position or being able to withstand a position for a period of time can also, be affected for that. And so too, for me, obviously, I'm looking at things for relieving their pain and their symptoms and improving overall quality of life during this, you know, pregnancy and things. But then I'm also looking at, okay, labor and delivery, we want to optimize everything that we can for that too. And that's just going to carry over into that postpartum period.
Yeah, definitely.
Yeah.
It's crazy because I just remembered whenever I was in labor with Daniel and I would have contractions, like I was in actual labor, like I was like 8 centimeters. But I remember telling everyone who was there at the birth team, I remember saying, these contractions are literally nothing compared to the pelvic pain that I experience every day. Like I just remember being like, and that blows my mind. That blows my mind that my active labor pain is a shadow compared to the pelvic pain I was experiencing. So that just, I don't know, randomly came to mind. But that leads me to want to ask you, what are the benefits of seeing a pelvic floor physical therapist during pregnancy as preparation for birth? What are some of those studied or other benefits that relate to that? Instead of, like you're saying, the client who's like, oh, I'm connecting with you because I just want to meet with you after for postpartum recovery. But what are the benefits for that, for the birth itself?
Oh gosh, so many. I think for one, obviously, it just depends on when I see you. So if I were to see you early on in your pregnancy, looking at all of those imbalances, I want to see how you move. I want to see your posture. I assess, yes, your deadlift or your hinge. I look at your squat. I look at your ankle mobility. I look at your calf strength, because so many people don't realize that as we progress in our pregnancy, because of those changes in center of mass and how we walk, or if we start to get that waddling gait pattern, which again, that's you trying to create stability because you don't have the stability there. So like you said, we need to work on that. But, looking at calves, because a lot of times I actually see more of that calf weakness creating issues with like leakage with running postpartum or jumping. So I always start to work on that during the pregnancy, make sure that stays strong just for that carryover into what the client's goals are for postpartum. But then we look into, again, diaphragmatic breathing, right? Because that's going to carry over into our labor and delivery, as well as core strength. I look for obviously any changes in the abdominal wall. We know no matter what, 100% of mamas at the end of their pregnancy are going to have a diastasis recti. That's normal adaptations during pregnancy. That's totally fine, but it's how we're managing our pressure, making sure we're not doing things that are creating even more pressure onto the abdominal wall, and more so preventing things like umbilical hernias and stuff like that because of improper, pressure management. And then we go and we look at, of course, the mobility of the pelvis. And then the last thing I will look at is pelvic floor, right? Because we find that as we progress in our pregnancy, we do have more tightness within the pelvic floor. We have more tone because of, again, it has to work really hard to stabilize the pelvis and support, our bladder, our bowels, our reproductive organ, obviously our uterus and everything. So it has to work really hard. So we still need to be able to coordinate that muscle well. And more importantly, we need to be able to lengthen it with our breath and everything for labor and delivery. And so I start that even early on in that second trimester to say, okay, what are we doing to set you up for success throughout your pregnancy? Because that's not only going to help with pain management, but it's also, again, working on that labor and delivery aspect of things. And I think one thing that people don't realize too, at least for me and just the advanced training that I have, is that I work a lot on the mama's belly. And as so many, probably maybe for you when you had done physical therapy, because you did it during your pregnancy, did you say? Mm-hmm. Yeah, where they might have never even touched your belly. And so that's a huge component, because if we have tightness in our obliques, so those are the muscles on the side, because obviously we're making all these changes, the front abdominal muscles can't do what they need to do. So all of the ones on the side are overworking, they get tight. But then we also, how does that play into baby too and its room to move and grow? And so I really dive into the fascia of the belly and also to looking at all of the ligaments of the belly. So your broad ligament, your round ligament, your uterosacral ligament, ligaments that people don't even realize exist, because everyone knows about the round ligament, but none of the other ones. And so I will, usually I'll start that about like 32 weeks or so, where we can really see where is baby's head, right? Because I'll find within the pelvis, if it's off to one side or the other, then we look at the restrictions of what's going on within the fascia, but also within those ligaments. And we can help release those to help optimize baby's position, right? We can't spin babies or anything like that, but we can at least create space for them to allow them to do what they need to do. And so that's honestly, that's probably my favorite part of treating too in the prenatal period, is just really seeing, you make those changes and then seeing like the outcomes too of, less pain, less symptoms as far as leakage, because we know that during pregnancy, I think I had 2 yesterday that were like, oh yeah, I guess I leak sometimes when I sneeze, but that's just part of pregnancy. And I'm like, there's things that we can do to help manage that, because it's not necessarily it's not a weakness within the pelvic floor. It's an improper pressure management. You sneeze, all that pressure goes down. Pelvic floor is already tight and is saying, I can't do anymore. So I'm going to just do what I can, but it's not enough. And then we leak. And, things like that we work on. And then, of course, I also do like labor and delivery prep, when it comes to, I guess, like no matter what, like the childbirth education, I just do the birth prep more from like a pelvic floor standpoint. So why would these positions help our pelvic floor? And what do we need to do for baby during that time frame to allow pelvic floor to do and the pelvis to do what it needs to do to help progress labor and delivery? And then I think the most effective thing that I've been getting a lot of feedback since doing more advanced training, it's been a little while now since I've done it, but is I actually go through and I feel the pelvic floor as you practice breathing techniques for pushing. So I'll do it supine, so lying on your back. I'll do it like I'll have you rotate sideways. So you'll be side lying. I have you come into hands and knees, do it there. And then I have you come up into a tall kneeling position. And I think that really empowers our mamas because they can feel what's happening. And so I just actually had a mama deliver 3 weeks ago. She had also worked with chiropractic in the area, but we did that. And she goes, man, like hands and knees just feel so good. It feels so natural. This is how I want to deliver my baby. Yeah. And she delivered unmedicated on her hands and knees with full circle. And it was amazing. She's like, that helped. Something just clicked with it. And like, even back, I had a mama that I did a labor and deliver, or we did that last week. And she went through some of her hypnobirthing. And that's what I tell. I go, let me feel what you know, especially if you've done some of that education, and go through all of those different breath works. We talk about like open glottis, closed glottis, all those different patterns. And then we did that. And she was like, she thought that, I feel like this feels really good. But then when we actually checked, she was like, oh, wait, like that doesn't feel right. And so I changed this a little bit and tweaked it. And she was like, this is eye opening. Like now I feel it. And that's good for whether we have a unmedicated delivery or if we have an epidural, because your body's going to remember what we practiced and went through too. Like I said, lots of things. I know that's a long-winded answer, but I love it. I'm passionate about it.
I can 1000% see that. You are blowing my mind right now because it is so important. All the things that you're hitting on, just being able to be in tune with your body, pushing in the way that your body is telling you to push that's most effective. Because that's what I really try to tell my clients is you can certainly have an idea of the way you would like to push or the way you just imagine yourself pushing. But until you're actually physically doing that or testing it out like you're describing, you will not know what will feel best and will actually help move the baby down. And so that's amazing that you're doing that ahead of time. I had never even heard of a provider doing that. So that is like blowing my mind. Incredible.
Yeah, it's a lot of fun. And, yes, baby is also going to dictate some of that, right? So if it doesn't feel good for you, then we're going to change positions. But at least like you've seen what that looks like to some degree, right? So if you're in a tall kneeling position, that's similar to if you were standing. Or, a lot of times I don't go through it in a deep squat just for, other reasons, but we go through all those, again, other positions and stuff like that, because yeah, it's just easier to feel. And that way you have an idea. But of course, as you know, yes, I tell my mom is lean into what you feel, right? Baby's going to dictate some of that. It's also about what you feel, but just know that it's tools in your toolbox.
Absolutely. That's the
Yeah.
exact verbiage that I use is tools in your toolbox. And just to know that preparation that you're doing ahead of time isn't guaranteeing a certain outcome, but it's certainly getting you more tools in the toolbox to know what to do when and to just have access to more things that are available to you. And that's
Absolutely.
such a beautiful way to experience your labor, is to not look back and think everything had to go exactly perfectly, but that inevitably for everybody, there's going to be some aspect of your labor and birth experience, your postpartum experience, all the things that are not going to go according to plan, but just knowing that you can pivot to some other option or choice, that's really empowering. And so I love that's what you're providing for your clients. You are
Thank you.
incredible.
Oh, thank you.
If someone wants to connect with you, like I mentioned, follow you on social media, all the things, what's the best way for them to follow you and maybe even work with you?
Yeah. So I am in the process of building a website finally. Things have picked up here in Jacksonville very quickly for me in a very positive way. So I would say the easiest way to, at least if you're wanting to work with me or get more information or jump on that free discovery call, if you go to my Instagram, whether that be Nurture You _ Pelvic Health or Dr. Kate Smith _ PF Doc, there is a link to fill out a form for that free discovery call. So that way I keep track of everything and you're able to put in a little bit of information for you and what you're looking for. And so that allows me to have a better understanding even prior to us talking what you're wanting and what you're looking for, or if it's just more information. And so I usually take about 20 to 30 minutes to speak with all of my clients beforehand, just to connect with you and get to know you better. Because, just like any other profession, like I say, you want someone that you can connect with. I want to make sure that it's a good fit for both of us and that you're getting what you want, out of it. And you feel like you're getting that support back.
Yeah, absolutely. And are you working only with Jacksonville people, like local to Jacksonville, or are you working with people beyond just this immediate area as well?
So in person, of course, I'm just in the Jacksonville community. I have an office here in Jacksonville, but then I also do mobile services as well because of how crazy my schedule's gotten lately. But then I also do virtual. So I can treat anyone virtually. I have some clients right now that are out of state. And so that's really great too. And everyone always asks like, oh, is virtual better than in person? Obviously, I do a little bit more manual work myself in person. However, I can teach you all of those tools in a virtual visit. So it's just as effective as it is in person. And yeah.
Love it. Yeah, it's
Yeah.
just based on preference
Yep.
and where you're at in your life stage. Like for me, girl, I'm probably going to be booking a consult with you.
Oh,
For me,
thank
like
you.
in my life stage, maybe doing the virtual would be a better fit with just what I have going on in my life or whatever. So yeah, I love
Yes.
that you have all of those options. That's just incredible.
Yeah.
Thank you so much again for coming on, blowing my mind, sharing some major wisdom here. I so appreciate you.
I appreciate you. Thank you so much for having me. And this was so much fun. And as you probably know, I could talk about things for days because it's my passion. It's what I love, especially again, pregnancy and postpartum. It's so much fun. So
Yes,
anytime you want to chat about more things, we can do that.
we will. I will have you back on, girl.
Oh, awesome. Thank you
Thanks,
so
Kate.
much. Thank you again for having me.
That's it for today on Faith Over Fear, the Christian Pregnancy and Birth podcast. I hope today's conversation encouraged your heart and equipped you to trust God more deeply in your pregnancy, birth, and motherhood journey. Hey, before you go, I want to gift you with a freebie. I've compiled some of my most popular resources inside the Christian Mama Birth Prep Library. It includes practical birth prep handouts, such as the labor positions cheat sheet, birth preferences checklist, and provider questions guide. You'll also get exclusive discounts and even a worship labor playlist to bring God's peace into your birth space. To get instant access, simply visit faithoverfearbirth.com or click the link in the episode show notes to sign up. You'll receive immediate access to these valuable resources created just for you. If today's episode blessed you, please subscribe, leave a review, and share it with some other mamas who could use this encouragement. Your support helps more women find this podcast and embrace faith-filled birth and motherhood. Let's keep choosing faith over fear. Bye-bye for now.